Good morning.
Good morning.
Good morning. It's just you and me today. Good morning, everybody watching on YouTube. Actually, it's not just you and me. We have
We
Rafaela.
have somebody hiding over here off camera
Yeah.
who wants to remain anonymous. Okay.
Yeah. So, it's a beautiful day, though. Yeah. And apologize for the late start. I was busy with getting some work done and got carried away there. But
We have some people traveling this week, I think.
Judy's working today, and people are traveling too. So
Luz is in Spain, right?
Luz is, yeah, she traveled back to Mexico to her home. So the topic today is about the health benefits of mindfulness meditation. Just a recap, because in the past couple of weeks I've seen kind of health transformation in a couple more patients of mine who went into remission. So as time goes on, my list of miracle patients increases, which make me happy, because this particular patient had really active lupus and RA, and she really put it into remission with the practice of deep breathing, which is the basic of mindfulness meditation. And she now has no joint pain and no tenderness on the joint exam, which is amazing. Amazing, because she was once on biologic infusion and got into trouble because of the immunosuppressive effect of the biologic therapy, and got really sick with infection and sepsis and got hospitalized. And yeah, she was
she close to death at one point?
Well, not close to death, but very, very sick because of sepsis. And then we decided that, no more biologic therapy for her due to the immunosuppressive side effects. And the last resort for her was to do the deep breathing exercises and mindfulness meditation 3 times a day. I said that that's the minimum 3 times a day. And I think it's been a year now. So she's still taking 2 oral meds for rheumatoid arthritis and lupus. But in clinical trial, they define remission as being on medication and have 1 or 2 tender joints, right? Her last exam, she came in last week, she had 0 tender joints, all swollen joints. So that's the definition of remission. But my own definition of remission is to have no tender joints and swollen joints when you're on 0 meds. So this patient, I told her to start eliminating 1 oral meds at a time and see how she does. But at the start of her practice 9 months ago, I think, because I've seen her 2 or 3 times since she started the practice. So she only comes in every 3 months. So at the beginning, she had many tender swollen joint all over. She was flaring. She came out of the hospital too. So, but now she has 0 tender joints, 0 swollen joints, and doesn't feel any pain at all in her joint. So, but if she didn't do that, she would be in really, really miserable condition with severe pain and stiffness and difficulty with mobility and so on. So then we ask why? Why does the deep breathing 3 times a day for half an hour each time get the body into remission?
Biggest nerve stimulation.
Yes, and that's the basic of the mindfulness meditation, right? What do we do in mindfulness meditation? first thing is the deep breath. We first take a few deep breaths to focus our attention to our breaths, and then what do? As we get deep into mindfulness meditation, we focus on our six senses. Yes, we focus on our six senses to raise awareness of ourselves, right? Understanding ourselves. And when you know everything that's going on within yourself, including your mind, because the mind is the sixth sense, right? What are the six senses then? How? Just
well,
to recap.
From top to bottom,
Mm-hmm.
eyesight, hearing, smelling, tasting, touch, and maybe also mind's intuition.
Okay. Yeah. So when you are fully aware of all the senses in the present moment, you have the ability to do what? During mindfulness meditation.
Well, to examine yourself, clear your mind, understand, put your attention on things that bring you peace.
So we'll go back to the clearing your mind. I mean, during mindfulness meditation, what do people mean by clearing the mind?
Well, I mean, you talked a lot about the monkey mind, thoughts race, but just try to focus on something that's cool. Take yourself to a different place.
Yeah.
And you do that, I think, initially through deep breathing, concentrating on clearing your mind that way.
So, some people, when they say clearing their mind, they may mean having no thought whatsoever, an empty mind with no thoughts. But some people may mean clearing out their negative thoughts and bringing in the positive thoughts. So their minds are not empty of thoughts; they are just filled with different kind of thoughts, more positive, right?
Yeah, try not to let your mind race.
So to me, I think it's more like calming the mind rather than clearing the mind. Calming the mind, because if your mind is racing with negative thoughts, anger, and all of that, and you change it to being positive, then you are in the state of calm when you get there. So mindfulness helps to transform your mind and your health. It's actually transform, right? It's a transformation. It takes you through that path of transformation. But why does mindfulness give you all of these health benefits? Benefits for your mental health and benefit for your physical health.
Well, I don't know that I could explain the mechanism of action, but I think
just the basic understanding, because we're not talking to scientists. Everybody just needs to have a basic concept.
Your mind controls so much of your health.
Yeah.
And if you're like weighed down with anxiety, fear, health concerns, whatever, you're going to live that. Live that out.
Well,
so being able to have a respite from that and clearing your mind and focusing on positive things and focusing on your breathing, that obviously has a health benefit.
Yeah.
That carries forward after that.
So you talk about the mind and the health benefits. So, and you touched on the vagus nerve. So there is a two-way relationship between the mind and the vagus nerve, right?
Okay.
Right. Your thoughts can affect the activity of the autonomic nervous system, right? And then the activities of the autonomic nervous system can affect your mind.
And
it's a two-way relationship.
The autonomic system is what operates without thought and controls our sleep and all that.
Yeah. The autonomic nervous system, I think it operates on two counts, right? Subconsciously and consciously. We can consciously change the activity of the vagus nerve by focusing on our deep breaths, so that the deep breathing is going to activate the vagus nerve. And that affects the parasympathetic leg of the autonomic nervous system. But most often, it's our thoughts and our action that activate the sympathetic nervous system. Most often, right? Most often, because, we tend to think anxious thoughts, and that leads to the increased activity of the sympathetic nervous system, and that leads to high blood pressure and high heart rate, and you start to pant, and then you start to sweat. So all of that is like sympathetic nervous system being active. But when you have too much of the sympathetic nervous system activity, your body is going to be out of balance. And if you are in that state all the time, like chronic stress, right? If you are in a chronic stress state all the time, then your sympathetic nervous system activity is always elevated. And there's an imbalance between the sympathetic nervous system and the parasympathetic nervous system. There's always a fight or flight or fleeing, action, and there's not enough rest and repair state. Rest, relax, repair state. And that this heightened sympathetic nervous system can get the body sick, right? So blood pressure goes up, you develop hypertension, and heart rate goes up, you develop, tachycardia and early beats and things like that. Maybe AFibs even, right? AFibs, A-flutter, and ventricular fibrillation and all of that. And that can get you into, risk of stroke and risk of heart attack and messing up your metabolism, and then you develop diabetes and weight gain and all of that. The chronic stress leads to heightened, elevated level of cortisol, right? Cortisol is a stress hormone, and then the cortisol is also a steroid. So if you have too much cortisol level on board, then your metabolism is going to be affected too. So it's just like a domino effect. Start with anger or whatever, anxiety, and then it leads you down the path of where both physical health and mental health are affected negatively. So with mindfulness meditation as a medical tool, how does that help you?
Well, I was just imagining this snowball picking up speed rolling downhill with all the negative stuff.
Yeah.
And really what you're saying is the reinforcement of these bad thoughts needs to stop. And the mindfulness meditation lets you identify, stop the bad thinking, and shift your focus to the good, positive thinking about your health, about your situation, and that's going to have a health benefit. If I understood you correctly, that helps turn on.
Yes, yeah. But in mindfulness meditation, ultimately, we raise awareness to our six senses, but the final thing that we are aware of is our mind.
Yeah.
We work on our mind so that the thoughts change everything, right? So everything starts with the thoughts. Everything starts with the thoughts. Without thoughts, there is no action. I think that is, I need to prove that, but I'm thinking about people with dementia, for example. Do you think they have no thoughts?
No.
They have forgetfulness, but do you think that they have no thoughts?
No, they have thoughts.
They have thoughts, yeah, they have thoughts.
And they're probably having recurrent thoughts that they just had.
Yeah, yeah. So their minds still produce thoughts, but they just don't remember the thoughts. But the thoughts that are going on in their minds can lead to, effects down the road. Yeah.
I would think people with dementia, when they first learn the diagnosis, they're full of negative thoughts and worry about what's going to happen.
And
that's your right.
Yeah.
Poor self.
Yeah.
So, it would make sense that if somebody's diagnosed with that.
So if you practice mindfulness meditation every day, what benefits do you get? What health benefits do you have?
Well, you get better looking.
Okay, that's true. Your body will be younger, as has been proven by research. Yeah, so you grow older, but you don't look your age. You look younger than your age. Yeah. What else?
Stress control.
Yes.
I think it's a big part of it. Or your stress, you're probably in better health.
Yeah, so all the benefits will come in. It kind of bringing your blood pressure down too. I have patients coming off blood pressure medications just by doing the deep breathing 3 times a day, ongoing and non-stop, right? They don't stop their practice. They keep it as a daily habit. They go off blood pressure medication, so it helps to improve the cardiovascular system, right? Does it help with the gut system, the GI system?
I would have to think it would.
Yes, it does. Proven by research too. It improves gut microbiome, gut immunity, gut motility, all of it. Okay. Does it improve your hormonal system?
That would make sense that it would.
It would, yes, right?
Because that's tied to sleep, right? Hormones are tied to sleep cycle and all that.
Yeah, so hormones system, we think that hormones function in isolation. A lot of us think that, but it's not. It functions in concert with other systems. So if your immune system is weak, it affects your hormone system and vice versa. If your gut is not healthy, it affects your hormones and your immune system and vice versa. So all of your systems work in concert. And, it's just like traditional health care model is fragmented in that way.
Yeah, so the insurance executives are out there watching.
Yeah.
Listen to Dr. Tran and start to cover some of these things.
No, I mean, you just have to look at the body as a whole and see how the systems are interrelated and get the body back to health and not symptom control. Like in our traditional care model, if you have joint problem, you go to the orthopedic doctor or the rheumatologist. If you have heart problem, you go to the heart doctor. If you have problem with your brain, you go to the neurologist, and each of the specialists is the system fault. It's not the doctor's fault, but we were all trained the same way. Symptom control, right? If you go to the heart doctor and you have high blood pressure, you can take a pill to bring it down. Or if you have a headache and you go to the neurologist, you'll have a pill or an injection to bring it down. Nobody really going to examine the situation and find out why does a patient have high blood pressure, why does a patient have headaches, and address the root cause to remove the symptoms. But anyway, mindfulness meditation is a medical tool that would help you to do a lot of that.
Right. I think part of what you're saying is that FaceTime with a lot of healthcare professionals is limited.
Yeah.
So they're not going to get into all that.
But I'm not claiming that mindfulness meditation is the cure-all. It helps a lot, but it's not the cure-all. So if you meditate and you don't eat, you get sick. So you meditate and you don't get nutrients for your cells, you'll get sick. And you meditate but you don't sleep, you don't go to sleep at the right time, you're not going to heal. Healing is a comprehensive approach. It's not one thing cure, but we're talking about the health benefits that mindfulness can provide to assist you in your healing process, and also to maintain your wellness. So mindfulness meditation is not used just for the sick, but the healthy people can use it to maintain their wellness too and improve it further. Yeah. So remember, one negative thought in your mind can trigger a domino effect down the road that lead to physical illness. And if you don't take care of your physical health, it affects your mind, right? Well, that is why people start with joint pain, fatigue, and then they get all anxious because they're worried about their health. That's another example of how physical health, physical illness can lead to mental illness. People start to have anxiety, depression because of their physical illness too. Okay, so I just want to remind everyone that this practice will bring about a lot of health benefits for you, mentally and physically, and it helps all of your system, your cardiovascular system, your immune system, your GI system, your hormonal system, and your brain. Okay, it improves neuroplasticity, brain or the nervous system, central nervous system and peripheral nervous system. It helps both. It helps muscles too, right? It helps the muscle to relax. When you have such tight muscles that causes pain in your neck or in your lower back, when you meditate, it will reduce your pain, relax your muscles. But in itself, when you activate the vagus nerve for half an hour, your inflammatory cytokines will go down too. So your physiology improves, your biochemistry improves, right? So with that, let's practice for half an hour to get all of the health benefits. And let's take a deep breath in and slow breath out. And you can close your eyes if you would like to, or if you prefer to open your eyes and focus on something ahead of you, you can also do that. Start bringing your attention to your breath and return to this present moment. And remember, this practice is a practice with no judgment. So whether you're doing it right, you're doing it wrong, at the start, you don't judge. You don't feel frustrated with yourself. Breathing in slowly and deeply, and breathing out slower than breathing in. And as you breathe in, you know exactly how you are breathing in. And when you breathe out, you know exactly how your out breath is happening. After taking a few deep breaths and knowing exactly how you breathe, let's raise awareness of how your body interacts with the breath. How is your perception about the breathing? As you breathe in, do you have any feelings for your breath, for your breathing? Are you enjoying your breathing as you take in the air? In this present moment, you know you are returning to yourself. You're returning to your breath. You are bringing the awareness to your emotions that is associated with your breathing. Breathing in, I enjoy this breath that brings in the fresh air. Breathing out, I am aware that I'm removing all of the carbon dioxide. I am in this present moment with myself. Breathing in, I know I'm breathing. And breathing out, I know. And as I breathe in and out, feel this joy, feel this gratitude. And I'm thankful for every breath. Now we start our body scan meditation to bring awareness to our body, our six senses. Visualize that you are sitting in your favorite place. As you take deep breaths in and out, could be on the top of the mountain or down by the beach, or in your favorite room in your house. Deep breaths in, slow breath. Imagine that you see warm light source coming down above your head. As it touches the top of your head, how does your head feel? Let that energy flow slowly immerse your body. As it goes down to your eyes, you're fully aware of what your eyes are. What are your eyes seeing? What is your feeling towards what you see? That scene that you are seeing right now, how does it affect you? Now focus on your ears. What are your ears hearing this present moment? What is your feeling towards the noise that you hear? Deep breath in and slow breath out. Now focus your attention to your nose and your smelling sense. Are you aware of what you are smelling, taking in through your nose? Deep breathing in, breathing in. Slow breath out. Feel this air that enters being fresh. Feel the air that comes out of my nose being warm. As the light source is slowly flowing down, what are you feeling on your cheeks, facial muscles? What is your taste sense like? Here you may reflect on a few occasions how your mouth, your tongue serve you. And whether you have been speaking, talking with thoughtfulness, go slowly with the flow of energy down to your neck. What do you notice there? Hopefully your neck is fully relaxed by now. Now this warm energy, light source is slowly going down your shoulders. How do your shoulders feel? Deep breath in. Keep following the light source that is flowing down your arms now. Notice, what are you aware of? The sensations inside your arms. How does the forearms feel? How do the elbows feel? How do the wrists and fingers feel? Now focus your attention to your lungs and your chest cavity. Are you aware of how your heart is beating? Are working for you? We can take a moment there to express the gratitude heart. Now bring your attention to the abdomen cavity. And imagine this warm light source is dancing in all of the organs and immersing the organs in this light source. Here we can also express towards the organs that are constantly working for us. Now we come down to our lower back. We are aware of how our lower back is feeling. We notice the tension in the muscle. Bring our awareness towards the hips, the buttock. How are we sitting at the present moment? Are we in a comfortable position, relaxed position? How are we in the present moment? And seeing that light source slowly flowing down. Maybe now at the ankles and the feet. Deep breath in, slow breath out. With your breathing, are you aware? Do you notice how your bodies are? Are you fully present in this moment with yourself? Bring your attention and focus to your mind. How is your mind? Is it still racing or is it in a state of calm? it into a state of joy. You are fully present. What thoughts are going through your mind? Breathing in, you know you're breathing in. Out, you know you're breathing out. If you have any sad, frustrated, angry thoughts, try to look at them, recognize them, and let them pass by just like clouds, slowly flowing and drifting away. Do you see the good thoughts, positive thoughts entering your mind? Knowing what these positive, happy thoughts will do to you. See them, recognize them, express appreciation and gratitude for these thoughts. A few deep, slow breaths in and out. Return to yourself, return to this present. Start moving your fingers and toes, open your eyes. Be present. And that's the end of half an hour practice. I'm relaxed. How do you feel? How do you feel, Rafaela? Good? Yeah. So we're going to move our bodies, legs, arms for a little bit, do some stretching. My feet are numb. Random movements, do whatever you like to do. Stretching. Don't forget to take deep breaths in and out as you stretch.
Well, it's time for Boeing meditation.
Yeah. Okay, I think I'm going to stand up and let my legs recover from the tingling and numbness. Oh. And then we can do a few rounds of walking meditation. So as we walk, we try to pay attention to how our feet touch the ground, how the legs are moving, how we interact with the surrounding, and how we listen to the bell. Yeah. So you can take one step with each bell, or you can take 2 or 3 steps with each bell also. Don't forget to breathe slowly and deeply, okay? do one more round. Okay, so just have a quick discussion and then conclude the session today. So, how does everybody feel? I hope the people at home is feeling fully relaxed.
I feel relaxed.
Ready to go out there and enjoy the day.
Mow the grass.
Feel energized.
I think you made important points today about the connection between breathing, health, mindfulness meditation, and the autonomic nervous system, and probably the connection to sleeping too.
Yeah.
All of these
Sleep.
things, so it's good.
It helps you sleep. Yep. So remember to do it. It is a very good skill to have. I call it a miracle tool, actually. That's Harvard Medical School calls it a medical tool. But if Harvard Medical School now does a lot of research, a lot of talk, a lot of courses on, the alternative and integrative medicine. So, focus on nutrition, mindset, all of that. But remember, if you have a chronic illness, chronic inflammation, chronic pain, remember to do this for at least half an hour. That is the key. I have patients who do the deep breathing and meditation throughout the day, but only a few minutes every day. A few minutes each time they do it. Now, I don't see them go into remission, but my patients who do it for the minimum of half an hour and minimum 3 times a day, they do go into remission with time. So hopefully we'll have Rebecca back here because she is fully in remission of all meds and living her life and enjoying her life, doing lots of activities with her son. She's making up for the last time. So
I don't think I met her son.
No, but she's very busy now. Yeah. That's why she's not coming to meditation, but we keep in touch. So, well, with that, I wish everybody a beautiful weekend, peaceful weekend, and healthy weekend. And always think, kind thoughts, speak with thoughtfulness, and have love in your heart. Namaste.